All right, let's get into it. We all deal with healthcare in one way or another. But have you ever stopped to think about what's going on behind the scenes? Behind every doctor's appointment, every hospital visit, there's a hidden plan. Today, we're going to pull back the curtain and look at the architectural blueprints that shape our entire healthcare experience. Seriously, think about it. Why is the lab over there and the check-in desk over here? Who's really in charge of what? Well, it all comes down to something we can call an organizational blueprint, a master plan that dictates how everything and everyone is supposed to fit together. Okay, so Section 1, the architect's vision. You see, before a single wall goes up or a single employee gets hired, the architects, the leaders of the organization, have to start with a vision. It's not just about putting up a building. It's about laying a philosophical foundation that answers the biggest question of all. Why are we even doing this? And that all starts with the mission. This is the big one. It's the organization's fundamental reason for being. For a hospital, a mission might be something like to provide comprehensive emergency and acute care services. Simple, right? But that single statement becomes the bedrock for every single decision that comes after. Now, if the mission is the foundation, the vision is the incredible skyscraper they want to build on top of it. It's their North Star. So a vision statement like, to be a regional integrated healthcare delivery system, that's not about who they are today. It's about what they're dreaming of becoming tomorrow. And then you've got values. This is where the rubber meets the road, really. Values are the beliefs that guide the day-to-day actions of everyone inside the building. They're the attitudes that shape the entire culture and behavior of the place. All right, Section 2, the theoretical toolkit. So how do you actually build this thing? Well, just like real architects, the people designing organizations have different schools of thought to choose from. You can think of these theories as different toolkits that totally change how the work gets done. The two big philosophies are reductive and adaptive. The easiest way to think about it is old school versus new school. The reductive or classical approach is all about the work itself, breaking it down into small, efficient parts. The adaptive theory, on the other hand, that's more modern. It focuses on the people and how the organization can flex and respond to what's happening around. First up, from the old school toolkit, and you've definitely seen this before, is the division of labor. It's basically an assembly line for healthcare. Each person has one specific repetitive task they do over and over. The whole idea is to create specialists and make everything super efficient. Okay, so you've divided up all the work. Now what? You gotta organize all those specialized workers, right? And that's where you get the classic bureaucracy of departments. Nursing, pharmacy, lab, and so on. This structure is all about keeping things in order and maintaining a clear line of command. And this is how power flows through that structure. Think about that classic org chart you've probably seen. That's the chain of command in action. It is literally a map of authority, showing you exactly who reports to whom, all the way from the frontline staff up to the CEO. And this next one, this is a really critical design choice: span of control. It boils down to a simple question. How many people can one manager effectively keep an eye on? The answer to that question will determine the entire shape of the organization. For instance, if the answer is not that many, you end up with what's called a tall structure. Picture a really tall, skinny pyramid. Each manager has only a few people reporting directly to them. This creates lots and lots of layers of management, and decisions are very centralized, way up at the top. Now, the flip side of that coin is a flat structure. So instead of a skinny pyramid, think of a short, wide one. Here, managers have a wide span of control, meaning they supervise much larger teams. You get fewer layers of management, and authority is more decentralized. It's pushed down closer to the people actually doing the work. Section 3, drawing the blueprints. Okay, so we've got the theory down. Let's look at the actual blueprints, the common organizational charts that you see in healthcare today, to put all these ideas into practice. You'll basically see three main flavors out there. A functional structure groups people by their job, so all the nurses report to a nursing manager. A service line structure groups people around a specific condition, like a cardiac unit. And then there's the matrix structure, which is this complex hybrid where a nurse might report to both a nursing manager and a cardiac unit manager. Moving on to Section 4, from blueprints to networks. Here's the thing. Today, it's not just about a single building anymore. We're zooming out to see how these individual organizations are connecting to form these massive healthcare networks. They're like entire cities, really. Let's see how they link up. One way they do this is through what's called horizontal integration. It's actually pretty simple when you break it down. It's when similar places join forces. The goal is to connect like with like to cover more ground, expand their reach, and hopefully become more efficient. A perfect example is one big hospital system that starts buying up other hospitals in the region. They're all providing pretty much the same services, just now they're all under one giant corporate umbrella. It's all about doing more of the same thing, just bigger. The other big strategy is totally different. It's called vertical integration. This isn't about doing more of the same. It's about owning the entire patient journey from start to finish. So here, different but related organizations all link up to create this seamless chain of care. For example, a single healthcare system might own the hospital where you have surgery, then the outpatient clinic you go to for your follow-up, and even the home care agency that helps you recover once you're back home. They want to control every single step of your journey through the system. And our last section, Section 5, the living building. But, a blueprint is just paper and ink, right? The building itself, it's a living, breathing thing full of people. And that's where culture comes in, the unwritten rules that truly define how a place actually works. Because at the end of the day, it doesn't really matter what the org chart says. It's the culture that tells you how things really get done. It's those shared assumptions and values. Is it okay to be a few minutes late? Who actually speaks up in meetings? These are the real rules of the game that you're never going to find in an employee handbook. So what makes one of these living buildings a healthy place to be for patients and for staff? Well, it turns out there are kind of 6 key ingredients: skilled communication, true collaboration, effective decision-making, appropriate staffing, meaningful recognition, and authentic leadership. This is what separates a blueprint that just works from one that truly thrives. So when you look at the whole picture, from those rigid classical structures of the past to these sprawling adaptive networks we see today, the blueprint for healthcare is always evolving. It's constantly being redrawn. And that brings up the real question for all of us, which is, what part of this blueprint do you think needs the most urgent redesign for the future?